Hello, everyone. I am Donna McKay, the Executive Director of Physicians for Human Rights, PHR. Thank you so much for joining us once again for our speaker series on health and human rights topics and the implications of the COVID-19 pandemic. We've welcomed leading national and international voices in health equity, human rights, science, medicine, research, as well as voices from the front lines into this interactive platform. We've facilitated and invited conversation on many facets and challenges of this global health crisis. From our very first discussion in March of last year, we've emphasized that science must lead the way. And an important role that PHR has played during the pandemic has been to bring experts together and to provide a platform to help get their voices out there. So today I'm thrilled to welcome all of you live with us today to hear from an incredibly esteemed panel who are going to unpack the ethical, legal, and public health and human rights considerations of vaccine passports or proof of vaccine requirements. Are vaccine passports helpful or harmful from a public health, ethics, and human rights perspective? This is a topic that is becoming ever more timely, even this week in the United States with new guidance issued on mask wearing for those who are fully vaccinated. So I would like to turn it over to and welcome today's moderator, who is PHR's COVID-19 senior policy expert, Max Hadler, who has a long career working to promote access to healthcare for low-income, limited English proficient, and immigrant communities in the United States. Max is coordinating PHR's response to the pandemic, including our work to advance equitable treatment and vaccine access globally. So Max, thank you so much for leading today's very timely and important conversation, and I turn it over to you.
Great. Thank you so much, Donna, and thanks everyone for joining us from all over the world. I'm really excited to be here and to provide a little bit of an introduction and introduce our panelists and experts who are going to carry the conversation forward because they are the experts on this issue. Just to frame the conversation a tiny bit, and first a word about terminology. You've probably heard the terms vaccine passport, vaccine pass, vaccine authentication, vaccine certification. All of these things may mean different things in different contexts, and we'll do our best to distinguish what we mean in using these terms today, and then also think of them broadly under the umbrella of proof of vaccination systems. So why does Physicians for Human Rights care about this issue? Donna alluded to it a bit before, but for the past year plus, the organization, which is a health and human rights organization, has been responding to the pandemic, promoting public health and science-based approaches to combating COVID-19, and also ensuring equitable access globally to COVID therapies, including vaccines, in the name of the universal right to health. And we think of proof of vaccination systems that really existing at the intersection of these issues. Proof of vaccination is an existing public health strategy for certain types of vaccines from long ago, but it also poses really significant human and civil rights concerns. And we're also having this conversation at a really pivotal moment in the pandemic. The world cleared the 1 billion vaccines administered threshold recently, over 1 billion doses administered, but administered very inequitably around the world. More than 80% of vaccines have been administered in high and upper income countries, less than 1% in low income countries. We also see really severe disparities in vaccine distribution and administration within countries. In the US, for example, where Black and Latinx populations that have suffered disproportionately from the pandemic are also receiving the vaccine at much lower rates. And we also, again, today cleared the highest daily infection number of the entire pandemic. So we are really in the throes of this. There is a very severe humanitarian crisis in India right now related to a new wave of COVID-19 across Latin America. Fully 1/3 of deaths from COVID last week in the world were in Latin America. So this is a pandemic that is very much with us. And at the same time, the proliferation of vaccines has allowed some countries and some regions to contemplate what it looks like to allow for greater human movement as a result of vaccination and advances, and to implement systems. There are places in the world that have already implemented vaccine passport systems, but still raise really significant questions. So some of the questions that we want to address today are, can these systems be implemented equitably, especially given vaccine distribution to date? Can they be done with respect for human rights and civil liberties? In what circumstances should these systems be rolled out? What do we know about the longer term effectiveness of the vaccines, and how should that play into the conversation about how long these systems should be with us? And these systems also generate a huge amount of data. Who should control those data, and how does the control of those data affect trust in these systems? Because fundamentally, if people do not trust these systems, they will not work. So I'm going to pose some of these questions, and I invite you all to pose your own questions in the Q&A box. I'm posing these questions to a really incredible group of experts that we have gathered today and that have generously shared their time. If I read their bios in full, we would take a large chunk of the hour reviewing their bios. So I'm going to abbreviate them and then turn the conversation over to our expert panel and really encourage them to engage in conversation and perhaps friendly debate around these proof of vaccination systems. So without further ado, I would like to introduce our panel. We have with us Dr. Soumya Swaminathan from the World Health Organization. She is the chief health scientist at the WHO, a pediatrician, and a globally recognized researcher on tuberculosis and HIV. We have Orshi Breich from who is the senior advocacy officer at the Civil Liberties Union for Europe, and also clearly wins the prize for best virtual background in our event today. We have Larry Gostin, who is University Professor, Director, and Chair of the O'Neill Institute for National and Global Health Law at Georgetown Law School, and among other positions is also the Director of the WHO Collaborating Center on National and Global Health Law. And finally, we have Arthur Caplan, who is the Professor of Bioethics at the New York University Grossman School of Medicine and a member of the WHO COVID and Monitored Emergency Use of Unregistered and Investigational Interventions Committee. So, very esteemed panel. Lots of questions, I'm sure, from the audience. I'm going to kick it off and zoom out and ask Soumya to start us off, given the current context of the pandemic and global vaccine rollout. Soumya, what is your perspective and the WHO's perspective in our current moment about proof of vaccination systems?
Thank you very much, Max, and very happy to be on this panel debating, I think, a really important issue and question. Something that's on everybody's minds is, how do they get back to normal life? How can people start traveling again to see family and friends or for business? And countries are thinking about this as well. Now, before we get into the specifics of a vaccine passport or a vaccine certification, let's just look at the global picture on vaccines. As you said, it's an incredible milestone that 1 billion, the world has provided 1 billion doses of vaccine to people within 16 months of the discovery of a new virus and within 4 months of actually starting the first vaccination program. But when you look at the distribution of those vaccine doses, and there's a very good website called Our World in Data that tracks that, you see that about 80% or so of these doses have been administered in high and upper middle income countries. Another way of putting it is that about 1 in 4 or 1 in 5 people in high income countries across Europe, across North America now got at least one shot of the vaccine, some vaccine. Whereas in low income countries, it's still less than 1 in 100. And so many of the most highest risk groups, the healthcare workers, the frontline workers, the elderly that we had wanted to protect by this time, if we had distributed the 1 billion doses around the world, we could have protected the highest risk groups in every country. So there's a lot of inequity just now in what is happening. And of course, as we set up the COVAX facility to try to address that, but the issue has been that the supply of vaccines was all pre-booked by a handful of countries. And so the supplies into COVAX are not as much as we would like. Obviously, we think that's going to improve in the second half of this year, but really the goal of equitable, we're still far away from the goal of equitable access that we set for ourselves. Now, coming to the question of the vaccine certification, we have to be clear what we mean. If it is a certification of vaccination, we think that people should have that because it's part of a good immunization program. One of the things you want to do is to have the person who's been immunized, if it's a child, in every country, there is a card that the child has, which states how many doses of vaccine and when and so on. So just having a certification of vaccination is a good thing. It could be paper-based, it could be digital, and in fact, the WHO has been working with partners to design what we call a smart vaccination certificate, which would be a digital certificate that one could carry around on your phone, and it does away with the need for preserving these paper-based ones. And we're developing, the open source international standards so that all countries can have the same digital standards and it can be interoperable across borders and so on. So we can talk a little bit more about that later, but that is a separate issue. I think what you're asking about is how do you use this certification? Do people be given some preferential treatment for travel, for example, or for getting jobs, or for going into restaurants, or for doing certain activities? And that is where I think the WHO has a strong view that we are not at that point, because for a couple of reasons. The first one is a scientific reason in that we still are not entirely sure about how much these vaccines protect against infections, vis-a-vis protect against disease. What we do know is that most of the vaccines, and we have 11 vaccines currently in use globally, approved in different countries, but the majority of them do seem to protect against people getting severely ill and getting hospitalized or dying, and that's a really good thing. So that's why we really want to promote vaccinations. But on the other hand, we don't have enough data from all of the different vaccines to know how protective they are against infection. And we are seeing around the world, there are reports coming out about these rates of protection. Some are high, some are a little lower. These could be asymptomatic infections. So the bottom line is that you could be vaccinated, you could still get infected. You may not have symptoms, but you could be carrying the virus and you could spread it to others. So having a vaccine certificate is no guarantee that you will never get infected and that you'll never pass it on to others. So that's the scientific fact that we need to remember. Then, of course, we can discuss what are the ethical and other issues that would come in if you want to use this. And there are many ways in which people would get discriminated. And the one obvious one is that some parts of the world, if this practice were to come into being, there would be people who would be advantaged. They could, of course, have individual benefits by traveling and by resuming economic activity. But globally, there would be large parts of the world left out of this. And whether that would be good for public health or not, I mean, it's not very clear, because as I said, you could still be infectious, you could infect others. And with the variants that are now emerging in different parts of the world, you could have a vaccinated person who gets infected with a variant and then spreads it. So we have to think very carefully about the science before we go even further. I'll stop there.
Great, thank you so much for that overview and for the viewpoint of the WHO. I think given the really severe inequities in global rollout, it seems like the disparity that would be created by international travel is fairly clear. I want to invite Art to weigh in, who has been fairly outspoken and written fairly extensively about the potential benefits of using proof of vaccination in certain circumstances, and maybe responds to that and tell us a bit about the types of circumstances in which you think rolling out these proof of vaccination systems makes sense right now. And you're on mute. There we go.
My mute is something that many people would encourage, but let's go past that. Thanks, Max. Thanks, everybody, for coming. Thanks for sponsoring the panel. So I'm going to just jump into it and say a few things. I like the distinction between passports, which I think are what you use for international travel, and authentication, which has a variety of uses. And I was pleased to hear an endorsement of authentication. I think it's very important not to confuse the two. That said, we do have a history of using vaccine passports, yellow fever being the one that most of us are familiar with. I have my yellow fever card. It has all my vaccinations on it, including my yellow fever vaccination. And it is true that vaccination is no guarantee that you still couldn't be infected by a strain and spread it. But I do think it's also true that it's a great way to diminish that risk in terms of countries that have stabilized their COVID challenges. So I can imagine many nation states saying, look, we are not going to allow you to come in here unless you have a vaccination authentication as part of your passport. And perhaps they will require negative COVID testing to accompany that. But trying to do harm reduction rather than say this is a complete assurance, I think may encourage student exchange, resumption of tourism, resumption of business. If you don't do that, then I think countries will perhaps just lock down and say, no one's coming or going. We don't have any way to assess much of anything. I understand the variability in vaccine efficacy and, by the way, safety, and whether we have information on that or not. But at the same time, we understand harm reduction. We understand risk reduction. And a vaccine passport for international travel can be a key tool, I think, toward encouraging travel, not restricting it, but actually opening it up. Are there inequities? Absolutely. And I understand that some may be privileged to move about from certain countries or with passports, but at the same time, I'll just make 2 points. We don't have a principle that says no one can do X until everyone can do X. I mean, it's not a moral rule that we follow with regard to anything, and I doubt it's one that's going to be in practice upheld here. But oddly enough, it may become an incentive to start moving vaccine supply worldwide. People start to say, look, I can't exchange, I can't get anywhere from country X. You've got to start taking this supply issue seriously for us. You didn't do it before out of the moral obligation to save our lives or the moral obligation to cut back on incubation of new strains. Perhaps you'll do it and help us so that we can really open the world economy. So I don't see passports as necessarily inhibiting. I think the case can be made that they may well open the world and open the world to more controlled and harm reduction type of activities. Let me then jump, and I'll get out of this fast. There's a lot to say, but we can do it in the Q&A. For domestic use, let's just use the US. So here, authentication has become an issue. And there are many people saying, I fear authentication because I don't know who's going to see my records. I don't like the government knowing whether I'm vaccinated or not. I believe that we can have a vaccine authentication program that is properly controlled and vetted to protect privacy. It is precisely the need to start an authentication system within countries to protect rights, to protect one's ability to link or not link to other databases and so on, that makes the push to want to recognize the importance of authentication powerful. Also, it is pretty clear in the US and probably other countries that employers, not governments, are going to start looking for authentication. We see it in the US already. Healthcare, hospitals, nursing homes, very soon are going to be moving to authentication to protect patients, to protect the integrity of the workforce. I believe that over 100 colleges in the US are now saying, not back to the dorms without authentication. I know for a fact that a number of businesses that I've been talking to are getting ready in the next month or two to demand authentication to come back to work in person. Not that they wouldn't accommodate someone working from home, but they want to be able to assure their customers that they're safer, and they want to be able to assure that the workplace is as safe as it can be, even acknowledging it still may require distancing and masking and other continuing safety protocols. So my point is, the way to open up the economy, the way to make sure that you're doing your moral duty, let's say toward college kids or toward nursing home residents who in the US were devastated by the pandemic, something like 20% of the deaths taking place in a highly vulnerable population where we're still getting outbreaks because the staff is not vaccinated. That seems to me the moral duty is to get vaccinated. And then authentication is simply a spin out. So I'll end by saying this. The debate in some ways is not about authentication, it's about who's going to make me vaccinate. And we don't have mandates in place yet, but I think some are coming. Employers, private sector, healthcare entities. Joe Biden yesterday said he wasn't ready to take a position on military mandates. I'm going to tell you, he will be ready to take a position as soon as we get licensure on these vaccines, which is coming for some of them soon, which will address some of Sumia's concerns about which vaccines count. The licensed vaccines are likely to be the ones that are going to, suffice for authentication. So I believe internationally, vaccine passports are a road to opening up the world and to increasing supply for lower and middle income countries and the populations there who don't have access. I believe domestically, we're going to see authentication, and it's better to do it in a controlled manner, protective of civil liberties, than to just let it spread by the free market.
Well, Art covered a lot there. I invite anyone to weigh in. I would say, just by way of another prompt, Larry, you have also been on the record saying that there's a really powerful economic and social incentive to these systems. So.
Yeah, well, actually, not exactly that, Max, but I loved the way you said friendly debate. So I'll do a friendly debate. I'm kind of somewhere in the middle between Sumia and Art, and I admire them both just enormously. I mean, let's start with the international. I think Sumia is right. I mean, to me, it's unspeakable that you would have an international passport system when you have such gross inequities, when you have high-income countries hoarding vaccines, with pre-purchase orders, fighting to protect IP rights, not easily transferring technology to low and middle income countries. It seems to me that it would just, to me, the unconscionability of seeing, high income countries, people travel and get back to normal, and it takes years before our colleagues and our friends in other parts of the world do that. So I don't see this as like a yellow fever certificate. This is the scarcity behind the vaccines are much, much different. And I think the inequities are far, far different. So let me just now back up and talk about what I think the ethics are, and what I think are the good arguments and the not very good arguments. So why do we get vaccinated? I think there are three reasons why we get vaccinated. The first reason is to protect ourselves. The second reason is to protect other people for whom we come into contact. And the third is kind of a social signal. It's one of solidarity. I belong to this community. It's not me as an individual, it's the common good. And so I don't buy the autonomy and liberty argument that you see, particularly on the political right here in the United States. Everyone has an absolute right to make decisions about their own health and safety, but they don't have a right to impose risks on others. And so no one has a right to go into a crowded place, unmasked and unvaccinated, and expose others to infectious diseases that are potentially really serious, and particularly for those who may have medical vulnerabilities that doesn't enable the vaccine to protect them as well as it should. So I don't think the autonomy and freedom argument, in fact, I'm more like a Franklin Delano Roosevelt freedom. It's also freedom from fear, freedom from want, and security. And so just as you would want to protect the rights of the individual, you also want to protect the safety and health of everyone. And I think Art is right. Nursing homes, immigration camps, migrant camps, places like correctional facilities are highly vulnerable, and you want to have a large population. I also think that privacy, that I've called it digital health passes, but I think, Max, you've dubbed it correctly, and there are lots of different terms, but it's proof of vaccination. can be privacy protective, because if it's done right, it should be secure. It should be only a public health use and no other use. And it also should not look for any other information. It doesn't need your race, your sex, your sexual orientation. It doesn't need prior existing conditions. And so what the real argument here, to me, is one of equity, to make sure that everyone who wants a vaccine can get a vaccine. And if that's the case, so for example, universities, if a university would like its students, before they go into a high-risk dormitory context, to have a proof of vaccination, and they will make sure and offer that vaccine to any student who wants it, and of course gives exemptions for medical and religious reasons, it seems to me justifiable. So I'm kind of in the middle of Sumya and Art on this, but I just wanted to tease out what I think that the legal and ethical questions really are, the legitimate ones and the ones that really I don't think fly very well.
Great,
Max,
thank you for that. And
can I
just
make
to
one point just about
sure.
passports, international? You know, when we issue them, there is a distinction between having a passport and saying a country's going to pay attention to it, and having a passport and saying, that's nice, but we don't care. So it isn't necessarily the case that the whole world shuts down to only the passport carrying or bearing individuals. It could be an incentive.
No, but it segments the world, Art.
Oh, it does, but it
gives special privileges to
maybe. No, what I'm
countries
saying
that are
is
fully vaccinated against those that are.
Well, what I'm saying is we have this notion that a passport will be a must in order to enter. It can simply be documentation that I am vaccinated, and countries can do it as they will. For example, Greece may say, oh, well, if you're vaccinated, you can go on the tourist route, but we don't care about what else is going on with your vaccine passport or not, depending on labor. We shouldn't confuse, again, the power of the passport with the authentication. You can have vaccine authentication, get privileges in certain parts of the world. We have it here, as you know, Larry. There are places saying we'll give you special seating. You can do special things. It's segmented, but it's more in the reward side than it is the penalty side. That's my point.
So if I could just jump in, and I want to invite Orshi into the conversation and go, in addition to the authentication systems and making sure that people have access to vaccines themselves, I think there are also some real civil liberties concerns about whether people would want to participate in the systems, even if they have been vaccinated, from a data privacy standpoint or from distrust of systems and wanting to understand, you know, what the protections would be. So comments there, Orshi?
So my understanding is that quite possibly the first and most important question is not really what you are interested about now, but about basically the mandatoriness. So it seems to me that Arthur actually takes these vaccination passes to be kind of like an instrument that convinces people, because there are some privileges attached to it to vaccinate themselves. And in Europe, we kind of believe that since it is not, and I don't want to take a stand whether it should be mandatory or not, it's a different question, I believe, but at least for now, it is not mandatory, and it seems that it will not be mandatory. But once it is not mandatory to vaccinate yourself, attaching privileges to the vaccination status doesn't seem right. It's discriminatory. But thanks, I don't know, God, fate, whatever, it is not the case that either you have a vaccination pass or nothing, or a vaccination pass simply or nothing. What we will have, it seems, it's not, so currently the regulation is in the EU bodies, and they are discussing it right now. They have, the different EU bodies have different opinions on this, but what we will quite certainly have is a pass that contains a leg of test proof, vaccination proof, and recovery proof. So it will have information on all these three. And it still could be, in our view, quite discriminatory because many people just don't have, I mean, PCR tests are relatively expensive here and they are required for your free move or relatively free move between EU countries. So if you say that people who are vaccinated and have a vaccination passport or certification in their passport can move freely without doing anything, but people who didn't have yet the chance to vaccinate themselves or just don't want to vaccinate cannot do that. We also think that it's discriminatory. And it seems that there is at least some political will in the European Parliament to ask member states or oblige member states to provide free testing opportunities for people. So if it goes through, what will happen is that you can choose whether you just want to get yourself tested whenever you want to travel within the EU, or you have your vaccination and then you don't have to stay in line to get tested. I think it's a pretty good solution and it avoids all sorts of discriminations we don't want to have.
For that. And Soumya had raised her hand before, and I also just quickly want to note that there's quite a bit happening in the chat. Soumya put in WHO's guidance on mandatory vaccinations, and there's also links to a lot of the publications and conversations that our panelists have been involved in previously. So Soumya, did you want to speak further on that?
Yeah, so a couple of things. One was really to, on the issue of the mandatory vaccinations, where there may be some situations where countries start thinking about which groups of people it might apply to. The general public, well, you would have to really make the case for that. There would be a lot of issues if one tried to make it mandatory for everyone. But it could be healthcare workers, especially working in these kind of facilities, or those who are dealing with very vulnerable groups. It could be schools, for example, teachers in schools, and so on. So you could think of maybe people in the travel industry, those who really have a lot of contact. But then you would need to fulfill certain criteria, which would include the supply of vaccine, the proven safety and efficacy, because it's very difficult to do it mandatory when it's still under an emergency use license listing and when you still don't have full information. And then, of course, you would need to go through a process of decision-making, an ethical process of decision-making, where you involve the stakeholders and particularly try and involve the affected groups and the most vulnerable people in society to have a discussion around what it might mean for them, and try to understand the reasons why there may be objections. So that's, between individual benefit and public health, there's always, in many cases, I remember the days of HIV, when I used to see patients who were infected and they didn't want their spouse to be told. And there's a real quandary then for the physician about respecting individual privacy and confidentiality. And at the same time, the spouse is at risk if he or she doesn't know, or the partner, the sexual partner. So in those situations, one has to really weigh the benefits and risks and take a call. But I think coming back to, again, the way we look at it, and we have the international health regulations that all of our 194 member states have signed up to. These are negotiated, they were finalized in 2005, the latest version. They're being looked at again now in the face of the pandemic to see what changes need to be made in the international health regulations. And there's a review panel. And according to the rules, yellow fever is the only disease for which there is a need for mandatory vaccination when you travel to certain countries. And polio also, in some countries, you need to show proof of polio vaccination. So again, those are the two that are currently need the proof of vaccination, or you can call it a vaccine passport. Or in the case of COVID-19, the point really is, again, going back to the lack of supplies. When you're living in a world where you're not able to give everyone, there are millions of people desperate for a vaccine today, and they're waiting to get them, and they're not getting them. And in that situation, if we then put in rules which will now make it difficult for them to travel or to get a job. It's for no fault of their own that they haven't had a vaccine. It's not like they're reluctant or, they refused. They just don't have the access. And so, Art was talking about these privileges. Well, that is a form of discrimination. If you look at it the other way, because you're getting privileges because you have a vaccine, but it's not your fault that, you couldn't get the vaccine. And so you're adding, in a way, I think, insult to injury by telling people, well, you guys can't do these things. And at the same time, we are not, as a world, making those opportunities available equally to everyone. So I think that is really the biggest ethical question here, that are we going to further privilege those who are already privileged and further leave behind those that are already lagging behind, in terms of vaccination. So once we have adequate supplies everywhere, and then we think that it's a public health imperative, then the situation will be very different. And WHO's committee, the emergency committee and the IHR, they're the ones who govern the rules of the IHR. They have said they will keep on reviewing the situation. And there may be some situation in the future when we actually can think about something like this. We'll have more knowledge on the science, but we'll also have the supplies to offer it to everyone who is able to take it.
Yeah. I mean, I think, the legal, on the international health regulations, I've been talking with former general counsel at WHO, John Luca Berci, and probably the IHR, they would require a country to demonstrate some kind of a scientific basis before it used a proof of vaccination system. So it probably, from a legal point of view, wouldn't be completely ruled out. But I think you're absolutely right, Soumya. It seems to me utterly unconscionable to introduce international passport systems when you have, you can't even call it an inequity. It's just so grossly inequitable that I would really, it would tug at my heartstrings to think that we would put more burdens on already burdened populations while high-income countries are getting back to normal, our economies are booming, we're traveling. But within a country, if you can demonstrate that everyone who wants a vaccine can get a vaccine, proof of vaccination could get you back to normal closer. And you mentioned the EU rule and about requiring either testing or requiring vaccines, some proof that you're safe. To me, for WHO, for the CDC, for Public Health England, for Europe, and for every country, the most important thing is, how do we keep the population safe, and how do we keep them safe fairly? Though that is, to me, the crucial question. And and I can certainly see if you can get away from equity, that is, if you can assure that everyone who wants a vaccine within a country, say to go to a concert, a very crowded place, and that you either require a vaccine or proof of vaccination or proof of testing, that might work. Already the EU is doing testing. We were talking at university level about whether or not we would require vaccines or whether we might allow testing as a result, as an alternative. The important thing is not the means. The important thing is the end. And we have two ends that we absolutely have to be rigorous about. One end is to make sure that we make everyone as safe as we possibly can make them. That's our first job. And our second job is to do it in a way that's equitable and doesn't leave anybody behind. If we have those two goals really clearly in our mind and try to find mechanisms to enable both to happen, we'll be on a much better path, I believe.
So let me jump in and violate every one of Larry's intuitions about the right thing to do here. I believe the question becomes, is a passport system likely to lead to harm reduction? Or is it just discriminatory because you don't want certain people to come to you because you're stigmatizing them, or choose not to interact with them for non-moral reasons. My argument is that a passport system internationally can be harm reduction. If it is, if that's an empirical truth, then
That's
you don't.
utilitarian. That's not an equity. That's not an argument.
No, but then it says, I'm not going to wait
for
for
a utilitarian argument.
Sure, but the pure argument is we don't do anything in life until everyone can do it. And I don't buy that principle. The challenge to WHO and to Larry would say 95% of the world is vaccinated. There's 5% that's not. No vaccine passports until 100%. You're going to avoid the harm reduction until you completely, I mean, the world is not likely to be vaccinated in the sense that you're talking about, Larry, ever. If there are new strains popping up, if boosters are required, it's off the table completely. My argument is, let's go for safer and not hold to a standard of equity, justice access that says you cannot act until all have access. I don't think that principle is sound. I think it's too extreme. It might even be, let's not act until the majority have access. You might find that more compelling in terms of equity versus harm reduction. But the point of vaccine passports, let's just look at the Olympics. They're coming up. Japan has a 2% vaccination rate and nobody there is vaccinated. They may take a policy to say only vaccinated people get to the Olympics, only vaccinated people can participate, no fans. It's going to be a bubble. We're going to do passports and testing at the same time. I don't find that offensive relative to the population of Japan, which is a privileged country with a very horrible vaccination rate at present. So my point being, I'm not going to hold harm reduction hostage to everyone in the world being able to get it. By the way, if I followed that principle, there'd be a lot of distributional issues that we'd have to revisit very quickly because there are many things that we're privileged to have that the rest of the world doesn't, that we don't stop doing in the name of our health in a wealthy place. So I think the principle might better be put, I'll try and appeal on this one to you and Sumya, if the majority of the world or a lot of the world begins to have access and we make commitments to trying to get that supply done, would you be more comfortable with a passport system if it led to harm reduction? I'm not trying to do it as a way for the rich to discriminate against the poor or to rule out racial or ethnic groups being able to travel. I'm just trying to do it for risk reduction. If you can commit, let's commit to supply as we can do it, would it be reasonable to then permit it?
I think there's a fair amount of agreement on the need to improve global supply of vaccine, and I would strongly encourage everyone to take a look at people's vaccine information, look at information on Physicians for Human Rights site around global vaccine equity, which I think is something that we're all behind. But I noticed that Orshi wanted to respond to something a few minutes ago.
Yeah, well, if I try to reconstruct Arthur's argument, is that basically those who are not buying into some exclusive privileges connected to vaccine passports are committed to some sort of a leveling down argument, which I don't see how would that be true if there are alternatives to show that you are quite likely not a person who is infectious right now. So why would not it be the case that it is better and it's not committed to some leveling down when you say that, well, either you have a vaccine passport or you have tests, or you have tests showing that you actually recovered and have the antibodies. So why would it be okay to attach exclusive privileges to vaccination status if there are alternatives?
Yeah, not my position. I'm just using them together. Not trying to say only vaccine passports is what will do optimal risk reduction, but they're a tool.
So one question, and then I want to make sure we have a few moments for some questions that have come in from the audience. But I think one issue with the term passport is that passports are documents that are generally issued by governments, and there has been a fair amount of conversation and in some cases implementation of proof of vaccination systems by the private sector. So what role do governments have? And maybe I can pose this to you first, Orshi, as a civil liberties expert. What role does a government have in regulating or enforcing certain types of protections when it comes to these types of systems?
Well, I'm probably not in a very good position to answer that, only because I'm European. And it seems that it's a great difference of approach on what private sector can do in the US and what private sector can do in Europe. For us, it's unimaginable. It's just not okay to have private sector doing anything with your vaccination status. It's just really not okay. But as far as I know, in the US, the approach is very different. And Lawrence and also probably has a better understanding of that.
All I can say before I give the floor to Larry on this is we're governed by IBM, not by politicians.
Well, I hope. I mean, I hope that's not. I pray that's not true. But, if Google, IBM, and
there we agree, Larry. There we agree.
Are, God help us. So what is the role of government? I actually thought, I loved Soumya's initial statement about what WHO is doing. I'd really like to applaud it, because I'd like to see governments start to do that as well, which is, government's role is to make sure that if you've got proof of vaccination systems, and I agree you should separate the two, that they're implemented in a way that's privacy protective, interoperable, and secure, and that they're standard and uniform and authentic. And I love that WHO is doing that. The Biden administration, I think has done a great job, and I love Joe Biden. He's, I've got just a deep respect for him, but I don't think that the government's hands-off approach is a good one, because we've seen what's happened in the United States and other countries when the national government, the federal government, takes a hands-off and then just all chaos runs loose. So I think it's perfectly appropriate for the federal government not to take a position on how they should be used, but CDC should be providing scientific and technical guidance to states, certainly, and also to the private sector, to make sure that these things are if they are implemented, they're implemented in an appropriate way. So
okay, I'm just going to jump in and say I agree with that 2,000%. And there are already, Larry, you know this, at least 8 private companies, this will depress Rasulia enormously, setting up their own systems, inconsistent, not recognizing the same vaccine requirements. They're all over the place.
So amazingly, we're running short on time already, and there is a flood of questions. So I'm going to try to package a few of the different questions that have come in from the audience together, and ask Soumya first for your thoughts on looking ahead a bit. One question is very simply, are vaccines creating a false sense of security? And then I think somewhat related, and you mentioned the emergency use authorizations before, is it ethically correct to mandate vaccination or to be pushing vaccination through vaccination systems for vaccines for which we don't have data on long-term effects or long-term efficacy? So thinking of, maybe from an individual psychological perspective, what it feels like to be vaccinated, and then also knowing what we don't know and looking ahead. Can you comment on your primary concerns around this, looking ahead the next several months?
I think those are really good questions, because I think vaccines did create a false sense of security to the extent that people around the world, even in countries that were not significantly vaccinating, thought that now the end of the pandemic had come, because we had developed a number of vaccines and that they were proving to be safe and effective. So some people have described it as vaccine euphoria rather than vaccine hesitancy. So just the collective feeling of relief that we have vaccines, and the belief that that's now solved all our problems. And even countries that have vaccinated 2, 3, 5% of their population, loosening up, people moving around, no social restrictions, etc. And we've seen, tragically in country after country, what it leads to. Countries across the world, across every region, the same pattern has played out. You relax your restrictions without having that herd immunity in the population, cases go up, deaths go up. So I think it's going to take us a while to vaccinate 70–80% of the world's population. Until then, unfortunately, all of us will have to continue to be careful. And then, of course, there's the other issue I mentioned earlier about getting the data on specific vaccines and how much they protect against infection. We know now for some of the vaccines like Pfizer and Moderna that they probably have 90% or more protection even against asymptomatic infection. But we don't know that for all the others, and it could be possibly much lower, which has implications because you could be vaccinated, you could be protected from severe disease, but you could still get the infection and spread it to others, which means you would still need to wear a mask and so on if you are in a setting where you're meeting with other people. So there's still the science that we're learning. And the other question is about when does it become, even ethical to start thinking about, and I refer you to the document, the link I posted, where as long as there are still questions about vaccine safety and efficacy, it's really not ethical to force people to take a vaccine because we're still learning about some of these vaccines. We've scaled them up very quickly. We've had remarkable success, I would say, so far, but we know now by reports that are coming in, when you vaccinate hundreds of millions of people, you start seeing some rare side effects, and we're studying those now. And over the next few months, we will continue to learn more about these different platforms, and maybe there are particular groups that are higher risk for certain kinds of side effects, and we might end up modifying our guidance. So again, we're not at a situation where we know everything about safety and efficacy, and neither do we have enough supplies to say, yes, everybody who wants can get a vaccine. And then finally, I'd like to say that very early on, we have the Strategic Advisory Group of Experts on Immunization, the SAGE. They're the ones who make the policies on immunization. They came up with a prioritization framework, which is quite similar to the prioritization framework that the National Academy of Medicine and the CDC developed in the United States. Essentially, the whole world agreed on whom you should prioritize, who was at the highest risk of getting infection and dying. And recently to those groups of people, the committee has added seafarers and aircrew, because these people have really been, the seafarers particularly, many have been stranded actually in different parts of the world. And it's been tough for them. And many of these people are necessary. Their jobs make it imperative that they're on a ship or on a plane and taking cargo around the world. So they have been put into that prioritization framework of frontline workers. Teachers are in the second group. So the moment you finished with your highest priority groups, teachers, particularly primary school teachers, just because keeping schools open is so important. So there's a lot of thought that's been put into this type of framework when you're dealing with limited supplies, and we should follow that. And then, as I said, over the rest of 2021 and 2022, we will be in a different position. And then we should come back to this question. But at this point, it would be very premature for any country or group of countries to use this to provide privileges to people.
Thank you so much for that comment. And I think that's actually a perfect way to end the conversation for now, knowing that we will inevitably be continuing this conversation into the future, given how rapidly changing the panorama access and supply, particularly around and really drive supply as one of the binding aspects of access. I want to thank all of our panelists. Thank you, Soumya, Art, Larry, and Orshi for joining us. Join us again for future webinars on this. And I am going to thank you all one more time and thank the audience one more time and send it back to Donna to close us up.
Thanks, Max. So then one more thank you, really, to the panelists, also to you, Max, for facilitating this really great conversation. I know that we all benefited from a diverse set of perspectives and some good, healthy debate about approaches. I heard a lot more agreement than disagreement, especially in the area of the assurance of the unequivocal understanding that our approach must support first and foremost equitable access, and that we get there quickly. So it was great to hear ideas of how these different approaches might get us there sooner rather than later. And this is an area that PHR continues to galvanize around. So please visit our website, learn more about the work that you can do as advocates to pursue and push for vaccine equity, and continue to come back. Check PHR's website and social media channels for more information about our COVID webinar series forthcoming next week. Stay tuned. We are doing a webinar series focusing on how the United States Title 42 public health policy puts asylum seekers in danger. And I hope that our panelists will come back and continue to inform all of us as we maneuver through these very difficult and uncharted territories. So thank you all so much for today.
Thank you, Donna.